The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Today's webinar, How's the Water?, presented by our Water Quality Program Manager, Dan Shapley, will now begin. If you have any questions throughout the presentation, you can go ahead and type them into the questions module on the webinar sidebar on the pane, and we will be sure to try to answer those at the end of the presentation. Thank you so much. Without further ado, Dan, take it away.
Thank you, Dana, and thank you all for joining us today. As Dana said, this is our How's the Water talk, and it is based on the findings of our recently released report with the same name, How's the Water. We use that title because that's what we hear from the public. We have people asking us all the time, how's the water? Is it safe for swimming? And this is our answer to it, this water quality project, monitoring project that I'll be describing today. So I will go over what we're doing to test the water in the Hudson River, how we do that. I'll go over some of our major findings that are presented in this new report. And then I'll focus a little bit about how you as individuals can use the data to make good choices about where and when to enter the water, and then how we all can use the data to argue for better protections and a cleaner Hudson River. So why test the water? The first thing is we use it. I do. I hope you do. I know some of you do. We're kayakers. We're swimmers. We go water tubing, water skiing. We're out there on the river, and as we're on patrol, 150 miles of this great estuary, we see people every stretch of the river using the water for recreation, swimming, they're jumping off of rocks, they are diving in, children are playing at the edges. So we need to test the water to know, is it safe for these activities, and where it's not now safe, we need to make it safe, because that's how we've already voted to be using this great river. Currently, testing is insufficient by government agencies to show us that it is safe consistently. So this program is designed in part to demonstrate that it can be done, that testing can be undertaken on a widespread basis. We know that people want the information. As we put this up on our website, it's become the most popular area visited on our website. We've seen other programs spawn because of the project that we've started here. We're expecting more of those. So we know that people are hungry for this type of information. This is a project that gives it to them. And finally, we know that the data is driving change. It's driving positive improvements in our water quality, and ultimately that's what we want. We want to see our river clean. So specifically, what are we testing for? We're basically looking for sewage contamination, or more specifically fecal contamination, because it may not just be coming from our sewer plants, but our it may be coming even from wildlife, farms where there is manure spread, or their livestock. So there could be multiple sources in the water, and the important thing is where there's sewage, there are pathogens, and where there are pathogens, there's an increased risk of getting sick. The type of sicknesses we're talking about, primarily stomach ailments. We're talking about things that give you diarrhea, vomiting, unpleasant day or two of your life. But we're also talking about things like skin rashes, eye and ear infections, and the more rare but also real chance of more serious illnesses. We've talked with people who have spent long nights and even multiple days in the hospital with their children after exposure to the water, who are very concerned that they'll even come out of the hospital. So we do have the potential for serious illnesses that come with exposure to viruses, bacteria, parasites that come along with sewage in the water. So government testing in the Hudson River, as I said, is not adequate to protect us. We see New York City does weekly testing at a number of locations around around Manhattan Island, into the East River, Harlem River, and other waterways in the city, and they present this data online. They're really a model for what a government agency can do. We'd like to see more of this type of testing and reporting. Westchester and Dutchess County both test weekly at public beaches. Rockland County and Westchester County test at some shoreline locations that aren't official public beaches. That's also a positive thing. Ulster County only tests monthly, and the EPA recommends at least weekly testing at public beaches. Ulster County has two public beaches on the Hudson River, Ulster Landing Park and Kingston Point Park. So there's some variation in how frequently our counties are testing, but they're, the main point is that they're testing very infrequently overall at relatively few locations, I should say. And most of the counties you see on this map are not testing at all. So what did Riverkeeper do? We started to test. So as of 2008, we've been testing 74 locations in the Hudson River Estuary. Dating back to 2006, we were testing some of these locations. So on our website, you will see some data that dates back as far as 2006 for some of these locations. In addition, we're testing 96 sites on tributaries in partnership with citizen scientists. That's 96 as of this year. You'll see in the report fewer data points, but the same effort reflected there. You can find all of this data. We report it publicly at that website, riverkeeper.org/water-quality. We test monthly from May to November, and we're testing for a bacteria called entero. We refer to as entero. This is what the EPA recommends for water bodies like the Hudson that are both brackish and fresh water. So it's the best indicator for pathogens in the water that we're testing. We're also using the EPA's recommended guidelines and criteria for assessing where water is safe for swimming of those tests we're taking. The state, New York State, has not set new standards based on these EPA guidelines and criteria, and we're urging them to do that. They're in the process of considering that, and I'll talk about that just a little bit later. I'll mention quickly we are testing a variety of other parameters that are sort of basic water quality parameters, but they're not essential to the discussion today. We also have seen modeled on our program, and we've helped design a program in New York City where the Water Trail Association is testing dozens of sites around New York City where there are kayak launches and other public access points, and they're doing that weekly and posting that data also on the website. Their website, I should say. So how we test the water, this is just a quick visual to give you an idea of what it takes to gather all of this data. We have science partners from CUNY Queens and Lamont Doherty Observatory who take the samples with us while we're on our patrol boat. We have citizen scientists, as I mentioned, working with us in all of the tributaries. And then all of those samples, wherever they were taken, come back to us on the Riverkeeper patrol boat where we have an onboard lab. And the image at the lower right is a tray of sample water after 24 hours of incubation. So this is what we get at the end, and we've learned to assess this to see how the water is at that particular location at that moment where we've taken the sample. So what have we learned so far? The frequency and degree of contamination vary from location to location. So in other words, a sample at one location on the same day as a sample at a location just nearby could produce very different results. Either one could show clean water, the other could show contaminated water, or one could show a small degree of contamination, and the other could show a great degree of contamination. Also, the contamination varies at time at any given location. So with the exception of a few sites on our tributaries that we've yet to find a passing water sample, all of our sites have good water for swimming sometimes and not so good water other times. And that's really important to underscore because the biggest misconception we see from people trying to use our data is they'll look at the most recent test point and they'll say, oh, it was green, it looked safe, so therefore it's safe for me today when I'm going in the water. Or vice versa, the last test I saw showed poor water quality, therefore today it has poor water quality. And that's not true, and I'm going to demonstrate quickly how to make that kind of assessment for yourself a little bit later in the presentation. But before that, the rest of our main findings: rainfall often triggers contamination. I'll tell you why in a minute, and tributaries are often more contaminated. So now I'll just touch on each of these a little bit. Contamination varies by location. As you can see, at some locations we have 2/3 of our samples showing water that's contaminated beyond the point where the EPA would recommend swimming there, and yet we have many sites where hardly a sample has shown water above that limit. You see, for instance, on the left here, Croton Point Beach, a very good place for a beach. The water quality is rare. We've only, in 2 times since 2006, found water quality above that EPA line in the sand for safe swimming. And similarly, Little Stony Point, a very popular swimming beach that's an unofficial swimming beach, also very good water quality. On the other hand, on the right-hand side, you see a lot of sites in the Capital District where we have known CSO problems, that's combined sewage overflow problems. We have the Gowanus Canal where New York City dumps a lot of its sewage in rainfall events. Same story with Newtown Creek. So we see a lot of problem areas, a lot of known problem areas for reasons that we would expect. The good news on this side is that we do have plans in place in many of these locations that we've seen enacted over just very recent times to put significant investments into the sewer systems here. So hopefully we will see improvements at those sites. We will be tracking that with our testing. So just to underscore here, 3 sites very close to one another, all in Yonkers. One of them, right at the mouth of the Sawmill River, has failed more than half of the time we've tested, more than half of our samples, I should say. Stone's throw away, really, and in the middle of the channel, you see hardly any samples failing. And at the sewage treatment plant, which is maybe the first place people would think of as the problem, we see good water coming out of that treatment plant. And that's something we should expect to see. Our sewage treatment plants are designed to treat sewage. They're designed to take in the dirty water and put it out clean. So we're seeing that happen here at that plant more often than not, which isn't to say that there are no problems in that sewer system. We see here and elsewhere that the collection system, the pipes, the pump stations that bring the sewage to the plant are often the source of contamination and the source of discharges. So contamination, this varies both in degree and frequency. So you'll find a lot of charts like this in the annual report that is available on our website. And I've singled out 2 here to demonstrate how important ways you can read these charts and try and make sense of them. So the bar charts you'll see, the red and green bar charts that run down the middle, those tell you how frequently that particular location failed for that EPA guideline for safe swimming on a particular day when the sample was taken. The 2 columns to the right of that are also marked in green and red are measures of long-term water quality and taken into account not only the frequency of contamination but the degree of contamination. And those are the measures the EPA recommends using to determine whether we need to investigate sources of pollution in a particular area and work to change pollution permits and reduce pollution inputs to the water at these locations. So you can see a lot of locations where we need to do that based on our findings. I single out Catskill Launch Ramp and Kingston Point Beach here because, as you'll see, they both failed 16% of the time for that beach standard. But the long-term measures of water quality are different. We see at Kingston Point Beach, 2 greens in that column. That's telling you that overall this is a good place for a beach. Whereas Catskill Launch Ramp, you're seeing that there's a failure of the long-term water quality criteria here, suggesting that there's a need to control pollution sources in that vicinity and identify what's going on that's compromising water quality more frequently. You'll see to the right of those, the min and max counts. That again underscores this point where at Catskill you see very low counts. So we know the water gets very clean at times, and that's good. That tells us that the water is not chronically contaminated or constantly contaminated. But the high count in the right-hand column tells us that it's exceeded our limits of testing capability at times, which means it gets very, very contaminated. And to contrast that with Kingston Point Beach, you see the highest count there is at least an order of magnitude lower, again suggesting that this is a good place for a beach, but it does need to be managed so that it might need to be closed for a few hours here and there at times during the season. Our next finding, again, is rainfall is a common trigger of contamination. You can see during dry weather at our Hudson River testing sites, only 12% failed that beach advisory guideline that the EPA recommends, whereas an almost threefold increase happens after just a quarter inch of rain over recent days before our testing. It jumps up to 34%. So why is that? There are several reasons. One of them is the combined sewage overflows that we have in many of our communities. The Capital District, City of Hudson, Kingston, Poughkeepsie, Newburgh, New York City, northern New Jersey. All of these places have, and others have sewers that were designed to be combined with their stormwater pipes. So as the stormwater overwhelms those pipes, the sewage flows into the water by design. So there are long-term plans to control those overflows in each of those communities, but we're talking 15 years or more in some cases to control those sources. Even sewers that are separate, that have separate stormwater and sewer lines, still suffer during rain because the pipes can get infiltrated with groundwater and other problems causing discharges. And then finally, we do have also, particularly on some of our tributaries, septic failures, failures of septic systems, that is, and runoff from farms, whether they be livestock or vegetable farms where manure has been spread, that can also be triggered by rainfall. The next finding, tributaries are often more contaminated than the Hudson River itself. And this is counterintuitive. This is something that people don't think when they look at a beautiful stretch of the Rondout Creek or the Catskill Creek. These are places that look just gorgeous with farmland on the sides or forests, but and compared to the muddy Hudson River, you would intuitively expect them to be cleaner. What we're finding is, in fact, that's not always the case, and usually not the case. Our tributaries, this chart shows the tests in the tidal portion of tributaries only, and you can see almost twice as many sample failures in those tidal portions of the tributaries as in the middle of the river itself. So that led us to launch a series of citizen science projects that you probably have heard about. So we're working in 6 tributaries with over 60 citizen scientists who we're partnered with. I won't go into detail here. Your eyes have probably already found your way to the creek that's closest to you. You can see some of the sample sites. And here are the results. So this is, again, looking in the non-tidal portion of the tributaries above the first dam on each of the tributaries in our project. We see at the bottom the Hudson River sample results, overall failure rate of 23%. Each of the tributaries is higher than that. Some of them dramatically so. You see on the Sparkill Creek and Mechanical River, nearly 90, I'm sorry, in the Wallkill River, nearly 90% failure rates, 2/3 on the Rondout Creek. So we know we have a variety and probably a mix of sources on these water bodies. It's probably not only sewage treatment plants, of which there are some on some of these creeks. There are also, there's almost certainly failing septic systems. Some of them have agricultural runoff that we believe to be a problem. Some of them might be suffering even from contaminated sediments and a longer-term, longer-lived pathogens associated with those. That's a question that we're exploring. And as you can see, some of the most contaminated sites on our tributaries we've yet to see a clean water sample on them, on the Wallkill and some areas of the Wallkill and the Sparkill pictured here. I will point out that this is only based on 2 years of monthly sampling, whereas the data I'm presenting for the Hudson River is since 2008. So this is a smaller data set, so we may see changes as we continue these monitoring projects over time. But you can see that even at some of the lowest sites with the lowest failure rate, we have really pretty high failure rates. So we're seeing our tributaries have real problems that are going to take effort to address. So how can you use this data? To answer that, I'm going to jump to our website. So if you go to riverkeeper.org, I'm going to explain how I answered a question that came up just this week. Someone's called and said that they were going to be kayaking at Gaze Point, which is a beautiful stretch of the river in the upper third of the estuary, and they wanted to know what the water quality was likely to be. And they told me, well, I see your last test point was green, so therefore I assume it will be safe when I go in. And I'm going to show you what I told them. So here's how to find your way into this portion of the site. You go to water quality, you choose Hudson River data, you use the navigation here on the left to drill down to the region you're interested in, and then the specific site. And before I go there, I'll point out what this person was saying was that she saw this green dot, which represents our last test at this location, and said, okay, so the water's good. And that's not exactly true. I'm going to explain why. So we go in and look at the data specifically, and this demonstrates, as I said, one of our findings, that contamination varies over time. You see many very good samples, many instances when water was very good for swimming, but then sometimes when water was most certainly not good for swimming, with some very high bacterial counts shown in this column here. So the way to answer that question, do I want to go in this water, is to use our website to do some sorting. So first you sort the contamination levels, and you see, yes, indeed, the water gets very clean here. So it on occasion should be a very good place to swim. But if you sort again for the most contamination, you see that, again, they're very high, the area at times when it's very highly contaminated. So then I would go a little deeper and say, look, all of these instances when there's been high contamination are times when the area over here is in blue, indicating that we've had rain preceding the sample that we took. So right there, you're starting to learn something. If you scroll down, though, you will see that there are times when there's been rain and good water quality samples. So it's not a perfect one-to-one comparison, but it's pretty good. So you can start to see a little more pattern. You can drill down by rain that day, and you see, okay, sometimes that correlates, sometimes it doesn't. Rain the day prior, sometimes important, sometimes not. 2 days prior, bam, start to see that there seems to be a real pattern at this particular location that rain prior, especially 2 days prior, leads to some compromised water quality. And here in this final column, if you sort by total rain, you really see a pretty good pattern that if there's been an inch or more of rain in recent days, that would be a good time to stay out of this particular location. Other times, you have a much better chance. If it's been dry, you can see you have very good water quality overall. So unfortunately, this is the kind of effort you have to go through when you want to go swimming at each site, because we don't have predictive models and we don't have anyone telling you at the access point, go in or don't go in. So to return to our slideshow, one other important tool that's out there is the state's Sewage Pollution Right to Know website, which has an updated spreadsheet that should be updated daily that has reports about sewage releases to our waterways. So you can look at the most recent releases. You'll follow the link to follow this link when you get to this website, and you can see if there happen to be any releases near you at near the place where you're looking to get in the water. Now this is a very clunky way to find out this information, and we're working with the DEC on the Phase 2 implementation of this law, which was just passed in 2012 and has only been implemented in Phase 1 since 2013. So the next phase we hope and expect will include a better alert system through the NY Alert system that the state already uses for things like amber alerts and severe weather. So stay tuned for that. So as we come to the last portion of our talk, we're going to talk about some of the ways that we can use this data to help clean the water, our ultimate goal. So first of all, the data drives infrastructure investment. It helps us see where there are problems that need correction. Now these problems often have quite expensive fixes. you can see some of those I've listed here are commitments that have been made in recent years to invest in sewer infrastructure in our region. And these should be, all should have some effect on the Hudson River, and we'll be tracking them. The important thing for you individuals living in communities is to remember the water and remember your recreational use of it when the decisions come up to invest in these wastewater projects. We find over and over again, if the conversation is simply about the cost, there's an unwillingness to invest. If the conversation is about this waterway that we love and how we use it and how we want to use it, then the investment becomes that very much easier for communities to bear. Second, the data helps us enforce water quality laws. So it's another way that you can take an active role. If you are witness to a pollution event, there are things you can do to make a good report. I'm going to go through them very briefly. We plan to do another webinar like this soon that will go into some more depth on this topic. But the important thing is to take photos and or video, really document what you're seeing, note the date, time, and location, and report it immediately. We see, unfortunately, a lot of reports that come in a day or a week after the fact, and there's not much that can be done with those at that point. They should all be reported to the DEC, and we ask you to also report them to us, because we will then be the ones following up with DEC or making our own observations to support those that you've given us. The other thing is we can get active as citizens. As I mentioned earlier, New York will be updating its recreational water quality standards in the next coming months. This will be the first update in 3 decades. We want to make sure they implement the federal recommendations that we're using already to assess our water quality data. These will give us better management of our swimming areas. They'll increase pollution monitoring, and they will ultimately lead to reduced pollution and better quality water. So it's a really critical step. Please sign up to receive our email so that you can be sure not to miss this chance to weigh in as a user of the water. There are also other things you can do locally. Basic things that you hear talked about in all kinds of living green tips, but conserve water, maintain your septic systems. Don't flush things down the toilet you shouldn't. A particular problem that's cropped up new in the last few years are these products that are labeled flushable wipes. They're not flushable. They are clogging our sewer lines. They're leading to expensive fixes and sewage overflows. So be mindful of that. If you are going in the water, ask your local governments, your counties, your towns, whoever has some ownership of that shoreline, ask them to test and model for that location. Tell them you're going in the water and why it's important to you. And then finally, we need your help to investigate local sources. Our monitoring data gives us a broad view, but we always need help from people who live in the communities to take it to the next level and investigate and correct these pollution problems. Finally, please take pictures of yourselves in the water where you're using it, where you're already going in. This is a bunch of Riverkeeper staff members in the water at Croton Point just last week. I swim. I take my 2-year-old to the edge of the Hudson River. We have not stopped swimming based on the data, based on our findings. We love the Hudson. We want you to love the Hudson too. We just want to use it. We want to clean it ultimately so we don't have to think so hard about when and where to get in. And in the meantime, we want to provide the data to give you the tools you need to make a good choice. When you are going in the water, please take photos, document that. It's going to help us with some policy issues where we need to prove that, yes, in fact, the Hudson River is used and its tributaries are used for recreation. So you can send those to Neil Gully. His email address is there. We also have a Waterkeeper Alliance event this weekend where we're urging you to go to the water's edge, again, where you already go swimming, jump in, challenge a friend with a little video on your phone, put it on your social media, and use this hashtag #SwimmableWater to demonstrate where we want to use the water. So with that, I'm ready for some questions, which hopefully you've already been sending. And if not, send them now to Dana, and we will take some. No questions yet. Now's your chance. If you have any, you just type them into the little chat box. Okay, I think with that, my email address is on the screen. You're welcome to email me if you prefer more private interaction. And with that, I think we'll end the webinar. So thank you very much for joining us. And this will be recorded and put on our website. So if you missed anything, want to review it, or want to share it, we urge you to do that. And thank you for joining us.